Hello out there in television land. Do not adjust your television. We will control the video and the audio. You remember that? Yes, indeed, it's another edition of It's Your Health. I'm with my bride, who's not saying much now. We will be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Make sure you check with your healthcare provider before doing anything we mention here on It's Your Health. Be right back.
Welcome to the first part of It's Your Health. And you know, you really stress me. At the beginning of the show, you ask me a question. I go to answer it, you keep right on talking. I find that very stressful. It's difficult to do the show when you don't give me a chance to get a word in.
Now you know how I feel.
Oh, sure. I'm going to do the headlines. And okay. Oh, pent-up stress may harm health of middle-aged women. And even though I am hardly middle-aged, I'm sure it is for me too. Many middle-aged women develop aches and pains and other physical symptoms as a result of chronic stress. There is a clear link between stress and an increased risk of physical symptoms, i.e. men.
Huh. Well, I guess that's going around. So.
That's your medical comment?
Yeah, that's right. It's going around. Hey, listen, it's like a tire on a car. If you overinflate it and put it through too much stress, you're going to wear out prematurely. It's a good thing I don't do that to you.
Yeah, it's a good thing. Next headline. Ooh. We need to start over again with our relationship.
Oh, is that right?
Yeah, we need to start from scratch.
A do-over?
Yes.
I kind of like that.
I figured you would. Marriages forged on the internet may last longer.
Oh.
If you're looking for the perfect mate, a new study suggests you might be on the right track if you turn to the internet. Married couples who met online were slightly more likely to be happy and stay together than those who met the old-fashioned way. Those who met offline were more likely to be very old, very young, and not wealthy.
Well, you know, we've lost all those...
He's just having so much trouble even making a comment here.
Well,
he must be stressed.
That's right. We've lost all those social contacts that we used to have growing up. I mean, people would find each other, you know, perhaps at a church function, or maybe at a social function that was going in town. And all these things are kind of going by the wayside, and part of our technology, I guess, is this as well. And you know, why waste time, you know, going to a bar and trying to get picked up when you can do it online and not even leave your house?
You know, I think what this was trying to say is people weren't getting picked up. They were developing long-term relationships.
Oh, okay. Well, who's interested in that? But let's go to the next headline.
Poor sleep may worsen heart woes in women. Poor sleep appears to contribute to the progression of heart disease in women by raising their inflammation levels, but this effect was not seen in men. Poor sleep appears to play a bigger role than previously thought in driving long-term increases in inflammation and heart diseases.
Right. Well, we do know that heart disease and a lot of diseases are due to inflammation, and it just goes to show you need to spend a third of your life, which of course is sleep, in the proper sleep cycle, and that's becoming more narrow and more narrow as we get busier and busier. So you need to get proper sleep.
Yeah, and your sleep could also be affected by someone who snores like a train running through your bedroom.
Now,
that could affect it.
Don't talk about our dogs like that, please. Leave them out of this.
I'm not talking about the dogs, but as long as we're talking about sleeping, I have some questions for you.
Okay.
Tell me this. Do you watch TV or use a computer right before you go to bed?
No. Do you want to know why? Because if I activate my brain, I'm not going to be concentrating on sleep. The bed, it's hard for me to say this, the bed is for sleeping, and it shouldn't be used for other...
Rewind and do that again. I want to hear it.
It shouldn't be used for other entertainment activities, such as watching television or working your computer.
Okay, this one I know. Do you smoke or drink alcohol or caffeine before sleeping?
No. Of course, those things would jazz you up, so that would get you set up for poor sleep cycles.
All right. Do you exercise before bedtime?
Define that. No, we don't.
Well, you can't do anything but sleep in the bed, so that kind of eliminates things.
You're not supposed to exercise and get your heart rate and blood pressure up prior to sleep. That's a little controversial, but it's kind of old school. Yeah,
they're now saying it might not be so bad as long as your doctor says it's okay.
I said it was controversial. Don't you listen to me?
No.
Okay.
Okay, does your pet sleep with you?
Oh my God, 3-dog night. That may contribute more to sleep disorders than anything else.
No, there's only one that sleeps with us. The other 2 don't sleep with us.
Oh.
Okay, speaking of sleeping, let's talk about babies.
Yes.
We have a new baby in our family. And parents are always looking, I saw it online, they want to find new ways to stimulate their young child, like a newborn or a 3-month-old. They want to know what they should buy, what kind of toys, what kind of games, what they should get. Do you know what?
I'm old school. I would probably go back to basics and talk to them, sing to them, read to them. Is that right?
That's exactly right.
Oh.
You can roll a tennis ball and they'll be interested in that. When they're a little bit older, you could put a box of tissues in front of them and watch what they do with the box of tissues as they pull them all out. Singing to them is, even if you sing like I do, it's still good. It is.
All right.
Telling them stories and feel. People forget about the sense of touch. Let them touch different things, soft things, rough things. That gives them all kinds of things to learn about as their brain grows.
That's terrific. Good advice. Good advice.
And as the brain is growing on the people that are watching the TV show, maybe we should give them a break.
All right. Speaking of which, I told you it's the fastest half hour in television history. That concludes our first segment of It's Your Health. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Welcome back to the second segment of It's Your Health. I'm with my bride, and we are plowing through medical potpourri like it's no tomorrow.
We should do the second section now.
What are you talking about?
Well, it's time to do the second section of It's Your Health.
I think I just said that, sweetheart.
Okay. I'll do the headlines then.
That's a great idea. That's
okay.
Why you're here.
Irregular heartbeat may speed memory loss in seniors. I just experienced that just for a second. Older people who suffer from a type of irregular heartbeat called atrial fibrillation, I don't have that, but I do have a loss of memory, may also be more likely to experience mental declines. Heart health is an important factor related to brain health.
Yeah, that interesting study, atrial fibrillation means you've lost your regular heartbeat. And if you've lost the irregular heartbeat, you can get memory loss on 2 fronts. First of all, you could throw minor blood clots into your brain and not really know it. Or the fact that it's irregular, it may not be pumping enough blood up to your brain may not be getting enough blood to begin with. So those 2 things can contribute to memory loss.
Well, that explains that, because I found that somewhat confusing. But off that subject, why is it that as you get older, you have a pen in your hand and you set it down and 30 seconds later you don't know where you put it?
That's not that uncommon.
Really?
Yeah, it can happen.
Okay. It happens to a lot of people.
Right. Well, I think we're so busy with our brains, we sometimes lose focus, and that's not uncommon. Memory loss is not necessarily an issue in terms of getting Alzheimer's and things like that.
Okay. All right, let's get off that and on to our good old faithful medicine, aspirin. Aspirin may equal Pricier drug for preventing clots. aspirin appears to be just as good as more expensive drugs for preventing blood clots after hip replacement surgery.
Yes, we're always worried about blood clots, and aspirin is still the drug of choice, if you will, for trying to lessen the degree of blood clots you get, whether that means you're going for an operation or not. Usually after an operation, we give you either shots or more powerful medications. They are pricier, and according to this study, aspirin is still the gold standard.
You know how we were just talking about how people meet their spouses or their loved ones on the internet?
Yes.
Well, there was also a study done about how people meet in person. And self-admiring, men who admire themselves, self-admiring men attract mates more easily than other men do. Men with high levels of narcissism and unrealistically positive self-image coupled with feelings of entitlement have an easier time than others getting dates and mates.
So that explains it, huh? Well, let me ask you this.
Okay.
Who's, just as a comparison out there in television land, who's more narcissistic, me or Sam Lassant? That should be a no-brainer.
I'm going to have to think about that
All right,
one.
you'll
It's
have to
awfully
think about
close.
that.
Yeah, I really couldn't say.
Well, maybe women pick up on confidence. Remember what Jack Palance said, confidence is sexy, don't you think?
Jack Palance said that?
Confidence is very sexy, don't you think?
I'm pretty sure he did.
Did you just make that up?
No, I don't think
Was
so.
he a narcissist?
I don't know.
Now, he might have been.
Perhaps he was certainly a world-famous movie star.
Speaking of world-famous movie stars, they all have beautiful smiles
Yes.
and wonderful teeth. Do we have some advice for people about taking care of your teeth? And by the way, you have to take care of your gums too, because that affects your heart health, doesn't it?
Yes, there's no doubt the dental health, and just think of the mouth as still being part of your body. You still have to care for it. People with poor dentition and dental health do have more medical problems as a rule. Keep in mind that flossing may be just as important, if not more important, than brushing itself. But a lot of us out there don't recognize that the food can stain our teeth as well and set us up for at least cosmetic issues. What would you recommend there?
Well, like wine and coffee and Coca-Cola and all those kinds of things. Well, they tell us not to brush immediately after having that, because sometimes when you brush, you'll actually brush the stain into your enamel.
Oh, wow.
So you should wait about an hour or so before brushing, but you could rinse your mouth with water right away and then hold off on the rest of it.
Yeah, certain toothpastes have whitening parameters that might have peroxide in it, for example. You can get mouthwashes that do the same as well. So dental health is important.
And some of us, like me, have very sensitive teeth, so I use Sensodyne. And most people will wash out their toothpaste out of their mouth after they're done brushing. With Sensodyne, you're not supposed to do that. You let that in your mouth.
I didn't know that.
See that? You learned something new.
I'll have to listen to It's Your Health more often.
And use a straw.
Okay.
A straw will avoid all your front teeth when you take down whatever that is.
Very interesting.
It is very interesting. I have something even more interesting. Breasts.
Yes, well, speaking of which.
Let me ask you, is it possible for a woman to enlarge her breasts? They got all kinds of creams on the market.
Right. No. But what women might be interested in doing is perhaps making their breasts more fuller, if you will. Is that reasonable? And keep in mind that breast tissue doesn't have muscle in it. It's generally just fat and glands. But supporting the breasts are two major muscles, the major pectoris and the minor one. And by doing a certain exercise, you can enlarge those muscles, if you will. And in doing so, you will have better breast looking.
They will look firmer and they will be happier.
Perkier, perhaps.
Perkier, that's the word I was looking for, perkier.
Right, well, here's the exercise. Lay down on your back, okay, and get some dumbbells. Keep your husbands out of this. Get some dumbbells and simply pull the dumbbells up kind of over your chest. And by doing that, you will help the pectoralis major and minor muscles enlarge, which may have some
positive effect on your sense of self-confidence and narcissism.
Oh, I like the way you tied that together.
Thank you so much.
Okay. Now what?
Serious subject.
Okay.
Somebody called in with a number of questions about diabetes.
Oh, yes. Okay.
Okay. If their life is so busy, so how are they supposed to manage diabetes when their life is so hectic?
It's a good question. Diabetics, of course, epidemic in our country. It is going to be off the charts in the next generation. A couple things you can do. I know they sound simple. We keep saying it. First of all, I'd stop smoking. That's a bad thing, and diabetics who smoke are looking for trouble. You'd want to get a little bit more exercise, drop some weight, and as much as the people in New York City may not agree with you, you need to cut down on your soda intake. That's a concentrated issue there, so cut down on your soda intake.
And learn to cook.
Jeez, no, I don't want her in the kitchen. Don't learn to cook.
Well, I don't have diabetes, but people who have diabetes, if they can cook rather than going out to eat, isn't that?
That's true. That is true. Most of us are going out there and getting processed foods, and yeah, stay at home. But the kitchen is my inner sanctum. I kind of like that. So don't let your wife learn how to cook.
Let's not talk about it.
Listen, we just blew another segment away here. I told you it's the fastest half hour in television history. We're going to be right back with our third and final segment of It's Your Health. Your leader in healthcare information. Thank you.
That's us. Welcome back to It's Your Health. This is our final segment. It just goes by so quickly when we get to spend time together like this. It's so special.
Okay. Let's make this go even quicker.
Let's talk about deaths.
About what?
Dying.
Oh, okay, sure.
Linked to energy drinks. The FDA has posted adverse event reports for 2 more energy drinks, 40 illnesses and 5 deaths linked to Monster Energy, and 13 illnesses and 2 lasting disabilities linked to Rockstar Energy. I can't believe how many young people I see walking around with these.
Right. Concentrated carbohydrates, caffeine, and God knows what else. We really don't need it. They're linked to deaths and miscarriages in women and things along those lines. I just don't understand the concept. I mean, if you get back to basics and get your exercise and sleep hygiene together, you really don't need an energy drink per se, and they are kind of dangerous. So I'd shy away from those, especially if you're on the younger side.
I ordered something in the mail. I don't even remember what it was. It wasn't even related to energy drinks. And when I opened the package up, there was an energy drink in a plastic bag along with a note saying, "We're offering you this free sample to try."
Yeah, it's something you don't need.
Okay, let's talk about how to lose weight. There's a new way to do it that they claim really works. Do you want to tell us?
Misery loves company.
Because otherwise I could tell you, but I'll let you tell us.
Speaking of misery, misery-loving company, it turns out if you get yourself together with other people, your chance of losing weight will be increased. For example, the hospital just had a big contest, if you will, amongst various groups in the hospital, and they were very successful in losing weight. In fact, the team that lost the most weight, you know, you can name yourself a team. They said, "We want to lose like Notre Dame," and that was their motto. So.
And you're laughing?
Well,
it must not be football season yet.
That's true.
Well, that's the point. You know, when you think of exercising in a group, you think of everybody going out to an exercise class. No, everybody puts money into a pool, and you compete to see who wins the money by who loses the most weight. And that has proven to be very effective.
Yep, group therapy.
Mm-hmm. Speaking of effective, how about berries? They're very good.
Just coming about this time of season, strawberries, blueberries, chock full of things that will actually provide anti-inflammatory properties to your body. It's a no-brainer, right?
And women who eat blueberries and strawberries just about every day of the week reduce their risk of heart attack.
That's good news.
Yes, it is. It's good news for me.
What next, sweetheart?
I don't know. How come I'm always the one who has to be in charge of what's next? How come you don't be in charge of what's next?
I'm in charge all the time, sweetheart. I just like to sit here and relax.
That's the narcissist in him coming out. Okay. How do you know if you're really in love? Falling in love takes about 1/5 of a second. I don't know how they figured that out, but they did, which is why there's so many divorces in this country. So how do you know that you're really in love? You need help with this one?
Yeah, I do. How do you know? I guess you must know it, right? How do you know that?
Well, you believe that your partner's a good person.
Okay.
That's the first thing.
That's a good starting point.
You trust your partner.
That's very important.
You're not nervous wondering where they are or what they're doing. You trust them that they're going to do the right thing.
Why are you looking at me?
Because you're doing the show with me.
Oh, okay. Well, you should be looking at them.
Because he's doing the show with me.
All right.
You feel loved and accepted, and you feel that you give back that love and acceptance. And you're able to talk to each other about problems. Even when the problem is the other person, you're still able to talk to them about it. So there has to be open communication. You have to value each other as individuals.
And you accept all their faults. Isn't that important too?
I don't see that here anywhere. No, I don't see that one.
All righty. So we've wrapped that one up too?
Yep, we've wrapped that one up, and we've gotten to a very important one, sunscreen. Right,
this time of year. I think people have a lot of misperceptions about sunscreens. First of all, you have to get a good one with a high SP value, generally greater than 30. And you have to put them on rather frequently, like every 2 hours.
Well, first of all, you have to put them on before you go outside. You don't go to the beach and then put on your...
Oh.
You have to put it on while you're still getting ready to go out so that it starts working.
Exactly. I would avoid sprays, especially in children. Sprays are not necessarily recommended for kids, so go to the creams.
There's some new rules in labeling. For example, you won't find sunblock anymore, and they won't say waterproof anymore. They can say water resistant or sweat resistant. And if they're of an SPF 15 or less, they have to put a warning label of the possibility of skin cancer or premature aging.
Right.
So you've really got to do it, and as he said correctly, I might add, you have to replenish that. And what I learned that I didn't know was when you start seeing the tan, that's your melatonin, right?
Mm-hmm.
And that's telling you that your DNA has already been compromised.
Wow.
I never knew that. So I'm going to get a spray tan.
Maybe you should just avoid the sun, sweetheart.
I do that most of the time.
Yeah, I mean, it's...
But everybody who has tan looks so nice.
You look nice without a tan.
He wants to go home and see if we can use that bed for something other than sleeping, I think.
Right.
Okay. Do you think if you have a drink in the evening, you'll get a better night's sleep?
Yeah, we're back to sleep. Well...
Bed, sleep?
Yeah, probably not. Some people would, like to have a nightcap, if you will, and what alcohol will do is put you to sleep quicker, but it will affect your REM and dream cycle, and you may not stay asleep because alcohol's effect may last only 4 hours. So although it may put you down, it's not going to keep you down.
You're not going to get your second half of sleep, and you may wake up more tired than you were before.
Yeah, so don't use alcohol as a sleep aid.
And can't be beat juice.
Is that available? I do the shopping. I don't recall seeing beet juice out there.
Well, you see, you have to get a jar of beets, and they're in juice.
Oh, they're in the juice itself. Okay.
It's like when you hard-boil eggs and then you put them in the juice to turn color.
And is beet juice, that must be good for you then? Otherwise
yes.
You wouldn't.
There was a woman who called my mother frantically because her eggs wouldn't turn the red color of the beet juice, but she had never peeled them first.
Oh, that's...
Yeah, the beet juice is wonderful, especially for men. It will lower their blood pressure.
Ah, well, I'm going to go get some.
And that's always good.
Yes.
One last thing. Do you ever notice as you're getting older that you kind of start getting some hairs along over here?
You mean me?
I mean me.
Oh. Well, you do see that in women sometimes, yeah. They, because their estrogen levels have perhaps fallen, and they might get a hair coming out here or there on their face.
How do we get rid of them?
Well, generally I would just pluck it.
That's what I do.
Really, and just watch out for infection. You might want to rub it with some alcohol first or something. But I would just pluck it. Shaving, I think, creates more problems. So they do have creams and things like that, but it just is part of life, sweetheart. Don't worry.
Part of menopause. Men-opause.
Well, again, the fastest 30 minutes. Thank you for joining us, allowing us to come into your home and hopefully inform and entertain you.
Look around, see if you see any narcissists.
Remember, you're watching It's Your Health, your leader in healthcare information. See you soon.